the patient is experiencing some form of these, neurological conditions and maybe not able to walk or maybe not able to talk. And they've been able to identify the biomarkers that do correlate. So we've been educated now on, anti-Yo or anti-NDMA. Tell us a little bit about how certain types of cancer correlate with certain biomarkers that also have that certain presentation when it comes to the neurological symptoms.
Certainly. So there are specific types of cancer that are more prone or more closely associated with developing paraneoplastic neurologic syndromes. Neuroendocrine tumor, small cell cancers, teratomas, germ cell neoplasms, seminomas. Those are malignancies that we know are more likely associated with the development of these problems. So when we are assessing patients that present with different neurologic symptoms, the main role of the neurologist is to put together what the clinical syndrome is. So the combination of of symptoms plus the findings on the neurological examination is what makes us suspect the diagnosis. After doing that, the next step is looking at the biomarkers. So the biomarkers, especially antibody testing in the blood and in the spinal fluid, are critical because when found, especially in the right clinical scenario, if the antibodies are found, they're extremely supportive of, number one, supporting and defining or essentially making the diagnosis, but also they will help you in the search for malignancy, because we know that specific antibodies are associated with the specific types of cancers. For example, the one you mentioned, the anti-Yo or PCA1 antibody, is often seen in patients that have cerebellar degeneration and Mullerian cancers, which are gynecologic malignancies, ovarian tube, fallopian tubes, ovaries, and breasts. So we know that in that clinical scenario, a patient that presents that way, especially females, and if they're positive for the antibodies, those patients, until proven otherwise, have an underlying malignancy. So we know where to look. We know to look very carefully at the breast tissue. We need to look very carefully at the pelvis with specific testing.
Kind of back to a lot of times the cancer is not yet diagnosed, right? There's these really odd neurological symptoms, and maybe they're getting referred to this neurologist. Hopefully, maybe this testing is done. So really, it can be sort of an early part of the detection process for the malignancy side. And can you speak a little bit to maybe even a case study in your scenario where the maybe biopsies aren't showing the malignancy, but in reality, it came to be that there was in fact cancer? Certainly.
So it's not uncommon that patients would present with the paraneoplastic syndrome before the cancers are identified. So is that high level of suspicion in combination with knowing the cancer associations with the biomarkers that really is critical to make that early diagnosis, knowing where to look, because typically the cancers are found at very early stages, often limited to the organ, for example, lung, ovaries, testicles, or the organ plus maybe some spreading to the local lymph nodes. But it's very challenging sometimes because the tumors can be very small, because the immune system is doing a really good job at preventing that tumor from spreading. So, when we diagnose patients with essentially a clinical picture that fits and the antibodies are positive, then we really have to look carefully, because there's been instances in which sometimes the tumors are biopsied with a needle and you're not really getting at the core of the lesion. So the needle biopsy of a mass may only show some inflammation or some fibrosis or scarring. It's knowing that the association is highly indicative of a malignancy that really helps essentially discuss with our our colleagues in surgical oncology or general surgery to say, my patient has this rare condition, but I'm highly concerned that this mass or this small lesion that was found in the thymus or in the like lung or in the ovaries is likely what is causing it. So so that's really how it's important to have a close collaboration with our oncology colleagues, our surgery colleagues to get to the bottom of it.